Okay. Good morning, ladies and gentlemen. Good morning, everyone. Let me introduce myself. I'm Abir El-Bahiri, the head of the National Antimicrobial Team and Pharmacy Development Administration at the Egyptian Drug Authority. Welcome today to our session of the Egyptian Drug Authority. As we know, antimicrobial resistance affecting people at any stage of life, animal and plant. So in our session, we'll focus on the global threat of antimicrobial resistance and its effect on, or its impact on human and environment. Let me first introduce our speakers today. We have Professor Tamer Assam, the chairman of the Egyptian Drug Authority, Professor Hanan Hassan al-Balkhi, the Assistant Director General Antimicrobial Resistance at WHO, Professor Dan Sally Davis. She is the UK envoy on antimicrobial resistance, and also she is the member of the Global Leaders Group Antimicrobial Resistance Group. Dr. Takehiro Nakamura. Dr. Nakamura is the head of the International Environmental Technology Center, United Nations Environmental Program. Dr. Naeem Al-Qusayr, the head of WHO at Egypt, will attend with us this session. It's a great honor, Dr. Naima. And finally, Dr. Shireen Abdel Gawad. She is the head of the Central Administration of Pharmaceutical Care at Egyptian Drug Authority. And now, let me start the session. Let me invite Dr. Tamer Assam to share with us. Please, Dr. Tamer. Dr. Tamer will share virtually.
Good morning, everyone. Is it clear, the voice?
Yes, doctor, please.
Yeah, it's a pleasure to be with you, and I would like to introduce my sincere apology for not being able to come to Sharm el-Sheikh to join this quorum of brilliant, eminent, and especially our dear guests, Dr. Hanan. I'm really happy to see you again, and I know you are virtual too. And also my dear Dr. Naeem Al-Qusayr for her presence, and all the other distinguished guests. It's my pleasure to be with you, and I would like to introduce the IDA initiative for fighting or combating antimicrobial resistance, which is a serious threat globally and worldwide, that everyone has to do all the best in order to try to mitigate all the consequences would be a real threat for the whole world. So there is a little presentation that will be presented. The presentation is now. Is it available now? So the presentation is available for you now,
yes,
right?
Doctor, we can see it. Okay. We can see the presentation.
For the antimicrobial resistance, as I said before, it's really a global threat, because every day we are watching a lot of serious cases that cannot be treated because we have no access to effective antimicrobial, and there is a lot of statistics worldwide stating how serious this threat is going to be, and how far it's going to be more serious and more dangerous for the whole population all over the earth. So what we are saying, because we are now in COP27, it's not only affecting the humanity, it's affecting the environment and the environmental balance and the ecosystem, which is really a real threat for everyone to see and watch. That's why Egyptian Drug Authority and the officials in Egyptian Drug Authority try to inspire from the WHO guidelines and initiatives to make main dealers and initiatives to ensure that we are working together to main objective and aim. For the first one, we are trying to roll up or sum up the main initiative, the EDA, the Egyptian Drug Authority Solution, stands for 6 letters. The first one is that we are trying the Egyptian Drug Authority to make assurance for all access and the quality and the safety for the antibiotics provided to the patients. We are trying to ensure that we have a good citizen awareness and we have ensure to make information available for everyone. The second letter stands for development. We are trying to develop a framework and network through specialized committee that has to be making more dynamic decisions and keys to combat and mitigate resistance and making more rationalized use of these antimicrobials. The third letter stands for A, for adopt and establish more regulations and laws in order to ensure that we are on the right track regarding the DMD measures, that we are making proper market control and making even market monitoring and control in order to afford proper mitigation solution for this. The letter S stands for surveillance, that we are making extensive surveillance to ensure that what we have done, like an initiatives or accommodation, is coming through in the right. So we are making surveillance regarding the consumption rate of antimicrobials, how far we are able to succeed to mitigate and reduce the use of antimicrobials, making more rationalized use. And that's why we are trying to share this surveillance with the Global Data Glass AMC. And we are sharing with everyone to see how far the world is progressing in this area. And the letter O stands for open, because we are totally open as Egyptian authority to cooperate with all our stakeholders and our institutions in Egypt and outside Egypt, and of course WHO, to learn, to inspire, and to get in touch and exchange all knowledge, to have enough data, to see more tricks. And of course, we know that there is another initiative now looking to shifting back to old antibiotics, because microbiologists started to say that there is a cost effectiveness and cost fitness for this antimicrobial resistance. That's why it's a brilliant solution to start shifting back. And I'm talking quite good in this area because it's part of my background. That shifting back to old antimicrobial could provide a little solution. However, the main terminal solution is through rationalized use of antimicrobials and making more effort to make more awareness how we make proper and rationalized use of antimicrobials. The last level, which is the important one for myself actually, is the leveling up of fitness and training and education. Proper education and awareness for the people, for the professionals, will provide us the prevalent-wise solution, have a fast actions on ground to achieve what we need sincerely for mitigation of these rationalized antimicrobial use and provide terminal solution for the resistance, which may be great consequences. In this regard, Egypt will introduce the 2 initiatives that we are working and we are start sharing with our friends at TNT this initiative, and we do all our best through and to make it happening, inshallah. For all the patience and the support, I'm looking forward to hear more and more. Just thank you for everyone.
Thank you, Dr. Tamer, for your informative presentation. And now we'll move to our next speaker. Dr. Hanan Hassan Balkhi. Dr. Hanan, please join us.
everybody. Assalamu alaikum, and I hope everybody's well. Can you hear me, please? Can you confirm?
Yes, we can hear and see you, Dr. Hanan. Welcome.
Excellent. And can you see my slides? Can you see the slides, please? Can you confirm?
No, not yet, Dr. Hanan.
Okay, I uploaded them already. Maybe it will take a second.
Okay.
I uploaded them through Zoom. Can you see them now?
Not yet, Dr. Hanan.
Okay. Can the people who are virtual, can they see my slides? No.
No.
Okay.
We'll check.
And now?
It's starting, Dr. Hanan, okay.
For the invite. So I do apologize for my croaky voice. I'm not sure what's going on there, but it's good I'm virtual, so I won't be infecting anybody. I think the burden of AMR, as we've heard from our colleague Prof. Tamer, there's more than just 1.3 million deaths attributable per year, and that data came out earlier this year. But we also know that there's at least one child dying every 3 minutes from a multi-drug resistant pathogen from sepsis. We know that 28 million people are going to be probably living in poverty by 2050. And we know that the cost of multi-drug resistant pathogens by 2050 for the extra cost will reach $1 trillion. And there is possibly a 7.5% decline in livestock by 2050. Now, the antimicrobial resistance agenda is a very complex one, and the work had started long time ago, several decades ago, but there has been a more robust movement in 2015 after the first Netherlands Ministerial Conference on AMR, when there was a resolution to produce the 2015 Global Action Plan. In 2016, for the first time at the UN General Assembly, there was a political declaration to establish the IACG, which me and Dame Sally were part of it, and the product of that IACG has also led to significant movement forward for the multi-sectoral work on antimicrobial resistance and other global governance bodies to be established, which I will touch a little bit on a little bit later. But since then, we have been seeing more and more activity on antimicrobial resistance, which I like to call a phenomena. It's not a disease. It's not eradicable. It's a public health urgency that requires work from all sectors, all individuals, and all governments. And that's why I'm quite happy that COP27 has created this event, because I'm pretty sure that Dame Sally will talk a little bit more on the linkages between climate change and AMR. I will try to focus more on the government's, the WHO and the quadripartite work. So I did mention the 2015 Global Action Plan, which we have through the quadripartite, an assessment. I don't want to go into the details of this slide, but I can just show you that the fact that only 17 countries out of 194 have actually a robust established AMR National Action Plan. All other countries are still trying to find their way, and I do admit that it is a very complex endeavor, and it needs to be taken up by the multi-sectoral committee within each of the countries. And I'm happy to see that Egypt is one of the forerunners in trying to find the solutions for this extreme difficult problem. So even though we do have national action plans in over 149 of 21, but I think we have even more, 160 from this year, we still need to work together in the different sectors to make these action plans effective and and efficient in reducing or bending the curve on AMR. When we had over 120 member states through several workshops ask them and created this word cloud, what are the most daunting or what are the most bottlenecks in making these national action plans on AMR move forward? The biggest issue was funding. Second comes coordination. But there are multiple things that are preventing the national action plans from moving forward. Resources, budget, monitoring, opportunities. So there's so many things that are problematic. So if we want to step back a little bit from the human health, what is One Health? We talk about the One Health response to AMR because the global good we're trying to preserve and make available to the human animal sector is the antibiotics. And antibiotics are used in the animal health, human health environment. And from the climate change, there's some few surprises also that some of the hidden bacteria in the glaciers that are melting away might be giving us some new surprises with new resistant pathogens. So the One Health response is really not just to use it as a trendy word, but it's really for each of the sectors to own and take their responsible part in responding to antimicrobial resistance by using antibiotics cautiously and also providing a hygienic environment so that we do not use antibiotics in replace of hygiene. So very briefly on what have we done with the One Health response, I think the first thing that we had to do is we had to align between WHO, FAO, WHO, which was referred to as OIE before, and UNEP. And we have done exactly that. We've moved forward with the global governance structures, which Global Leaders Group on AMR, which Dame Sally is a prominent figure in that group, and also integrated antimicrobial access, R&D, and regulation. These are the three top priorities that we're trying to work on in our group. This is the launch in 2022 when UNEP joined and we became officially the quadripartite. After that, we were able to identify the major works that is led by the quadripartite joint secretariat. I want to highlight in this slide on the left-hand side for each of the sectors, we have all four of us joint work that we need to do together. But at the same time, there are sector-specific areas that need to be worked on, and we have created our strategic priorities for WHO, and each of the sectors on their website have their own sector-specific priorities that they need to do to enhance the work on AMR. But the quadripartite joint secretariat has also is helping in promoting AMR, advocacy, political engagement through supporting the Global Leaders Group and the partnership platform that will be coming out soon, coordinate the multi-partner trust fund, coordinate the work plan and mapping gaps and potential opportunities, and coordination and partnership. You can find on our website the quadripartite strategic framework. I won't go into the details of this, but it's a robust document that was done jointly between the four organizations. And this is just a snapshot of the Global Leaders Group and some of the great work that they have produced, and one of them specifically dedicated to climate change. They have their specific KPIs. We have two amazing co-chairs and a very robust group of leaders that work with us, and we work with them at the global level to ensure the voice of AMR. I also want to invite you to the launch of the multi-stakeholder partnership platform that will be hosted at FAO, but still being worked on and supported by the quadripartite joint secretariat. And this is to host at least the largest number of potential stakeholders and partners to share information and to move the AMR agenda forward. And last but not least, again, there's a lot to talk about, but I wanted to focus on the very high level, is that we are also moving forward in next week to the third ministerial conference on antimicrobial resistance. And we're hoping that that conference will actually lead to our high-level meeting in New York in 2024. And hopefully we can finally try to agree on some targets. There's still discussions. It's still in the works, but I think that without having metrics, without without knowing where we're heading with the elements that lead to antimicrobial resistance, and the use in the animal and the human sector are two very important areas. We will not be able to move the needle on AMR. So we're very happy that we will be having the conference in Oman. And with that, I hope that I gave you a very high level impression about what we're doing in antimicrobial resistance. And thank you very much.
Thank you, Professor Hanan Balkhi, for your comprehensive and focused presentation. We really appreciate you are here today. Now we will move with our speakers. With next speaker, Professor Dame Sally Davis. She is the UK Special Envoy on Antimicrobial Resistance, and also she is member of Global Leader on Antimicrobial Resistance. Please, Dr. Sally, join us.
Thank you very much for the invitation to join you. And let me start by commending Egypt for the great work you've been doing, and Professor Tamer for your leadership. Because, you know, time and time again, the alarm bells have been sounding on AMR. AMR is not a new problem, but it's increased because our interconnected global human, animal, and environmental systems are failing and reaching a point of irreversible social, economic, and environmental damage, as my colleague, Dr. Hanan Balkhi, began to talk about. And it, like COVID-19 and flu, AMR is complicated, not just limited to humans. Our animal health, food chain, and environment are all part of it, all at risk. Everyone here today will, I believe, be in agreement that effective antibiotics are critical infrastructure for health, for food and environment systems. They're essential for farmers to live healthy, productive lives, and for food-producing animals to be treated when they're sick, when people or animals can't access the treatments they need because they don't work or they aren't available. It's a problem for the whole world. And as the global population increases, and with it this global demand for cheap protein, more of our antibiotics are being squandered, not just to treat diseases, which is right and proper, but as a cheaper alternative to good animal husbandry and farm hygiene, and as a way to promote rapid growth for a faster route to market. In turn, these are transmitted into the environment. A marine environment spreads resistant bacteria to places they really shouldn't be. A major new study sampling rivers from across the world found antimicrobial pollutants in surface water in over a quarter of the studied locations, which poses a threat to human and environmental health, with the highest concentration of drugs found in Lahore, then La Paz, and Addis Ababa. Recent research, taking samples from the Galapagos Islands, it's awful, found that giant Galapagos tortoises, which live in contact with human farming and tourism, or those in urbanized zones, have more bacterial resistance to antibiotics than those living in the more isolated ecosystems. The detection of these bacteria in the Galapagos archipelago for the first time turns them into environmental pollutants and the tortoises into potential sentinels or bioindicators of the health of ecosystems. And researchers in Northern Ireland have been looking at how marine plastics might be spreading drug-resistant microbes through our seas and oceans, as if having that plastic pollution floating around isn't bad enough. It looks as if they build biofilms on the plastics, making the problem of drug resistance even worse. So our behaviours are mortgaging the health of the planet, perpetuating inequalities that got us such bad COVID in the first place, alongside a historically unprecedented increase in global poverty. This year, the world's first and most comprehensive estimates of global burden of AMR to date were published, and you saw them mentioned over 1.2 million deaths directly attributed to AMR in 2019 and rising, making bacterial AMR, it's a bigger killer than HIV, TB, or malaria, each of those, and almost 5 million deaths were connected to AMR. This new data has got to be a wake-up call to the world for how and where we must target and tackle infections, just as you are doing in Egypt, how we can redefine our global health and food system's strength sustainability, and security. With the highest burden of AMR found in sub-Saharan Africa, the most fatal pathogen globally being E. coli, this data has to be a wake-up call for all of us to lead the way to ensure the development of therapies and vaccines, as well as diagnostics, to detect and steer appropriate use. We know national action plans for AMR form the backbone of the multi-sectoral response, and we've seen where we are. Sadly, not enough financing and not enough implementation. And crucially, we do need to set targets. We in Britain have used our national action plan to target reducing antimicrobial use in humans by 15% by 2024. It's proving difficult. And in food-producing animals by 25% between 2016 and 2020. National action plans can drive, as we've seen locally, substantive changes at all levels through collaborative and multi-sectoral voluntary approach to antibiotic stewardship in livestock production. I'm proud that in Britain, antibiotic sales for animals has halved since 2014. And over the same period, the highest priority critically important antibiotics use has reduced by 72%. More to go. But now the UK is one of the lowest users of antibiotics in agriculture amongst those countries with significant livestock farming industries. And it's all a testament to collaboration in agriculture, with data playing a vital role. The British Poultry Council set up a data collection system. So with that information, over 90% of the industry was involved, and then they could speak from a position of knowledge and deliver their strategies. They reduced by over 90% the use in the poultry. Data is vital. It's vital for comprehensive surveillance system of the food chain, and we are just starting in the UK one of these. Because as my previous speakers have said, surveillance underpins our understanding about interconnectedness of human, animal, and environmental health. Data helps us target our interventions where they can make the most impact. So I'm very proud of our UK Fleming Fund supporting low and middle income countries to collect and share AMR data and join in the WHO GLASS programme. We've got over 22 country grants and fellowships across sub-Saharan Africa, South Asia, Southeast Asia, developing country capacity, enabling countries to develop and own their own surveillance systems. The Fleming Fund is driven by a One Health or integrated health approach with multiple ministries and sectors involved. So in Nigeria, one of our animal health fellows works on food safety at the Department of Veterinary and Pest Control Services. She led the Nigerian delegates to the Intergovernmental Task Force on AMR and uses her knowledge to develop Nigeria's multi-sectoral national action plan. So governments are beginning to recognise the health security and economic security go hand in hand in AMR as well as COVID. Infectious disease is no longer the sole domain of medics, but it belongs with economists, finance ministries, central and multilateral banks, investors, and insurers. But AMR is also driven by economic problems. The market failure that stymies the bridge from innovative research to patient access and send small companies developing new products into bankruptcy. And during the G7 presidency, the UK government and then the German government have worked on this with the finance ministers moving forward. And our UK's new antibiotic subscription model awarded contracts to both Pfizer and Shionogi with environmental credentials as one of the key criteria being used. G7 have also made some inroads on addressing supply chain security, which matters to all our countries together. And innovation can't just be limited to human health treatments. We need much more for prevention and preparedness. Our UK Global AMR Innovation Fund is, for instance, co-funding with the International Development Research Centre innovative projects to reduce the use of antibiotics in farming, including nanobubble technology called fish jacuzzis for fish farms in Southeast Asia. So We can look across the world and there are great examples everywhere. And we are already in a stronger position of coordination this year with the formal integration of the UN Environment Programme into the quadripartite, as Dr. Hannan showed us. And the UN Global Leaders Group on AMR, which I sit on, is working to ensure that a One Health and integrated approach underpins any treaty or legal instrument that countries are currently negotiating to bolster global preparedness to the next pandemic, whatever it may be, while we live through the end of the COVID pandemic and the actual antimicrobial resistance pandemic. We need capacity building. We need to promote responsible, sustainable use of antimicrobials. And knowing the risks between health, biodiversity, and animal health are linked, we've got to find solutions that tackle those connections, not work in silos, welcoming the private sector where they can help. COVID-19's been a big flashpoint, but investors were able to do things. And our companies were able, based on previous investments, to produce vaccines and treatments. AMR action matters in the real world, surgeries, in farms, in laboratories, and schools and social media. So we need consumers pressurizing supermarkets and fast food chains. My students here in Cambridge, where I live and work day to day, have been going to annual general meetings of Yum, of Wendy's, of McDonald's to pressure the shareholders to follow suit on AMR. And we must go on working on the One Health spectrum. And so I hope that we will soon see an intergovernmental panel or the independent panel on evidence for action against antimicrobial resistance, because we all know how the IPCC has helped us move forward on climate change. In fact, their report last summer provided an unequivocal code red for humanity, laying the consequences of our inaction bare. But it doesn't just go for climate change. That's true for AMR. We don't understand where the key vulnerability points and risks are for emerging infections and interactions with the environment as habitat and food source. So we really need an independent panel looking at that. We've got to transform food, health, and environment systems to be more resilient, sustainable, and equitable. And that's one of the strongest opportunities we have to deliver the SDGs. And we know, as we see with other bits of climate change, our behaviours and interventions to mitigate interconnected AMR risks can increase and create value for everyone in terms of productivity, wellness, sustainable systems, and supply chains. So, as you heard, in 2024, all the world's eyes will be on the high-level meeting on AMR at the UN General Assembly in New York, the most important moment on AMR in almost a decade. We've got to seize the opportunity to tackle this silent, insidious pandemic of AMR, build on initiatives like this COP27, the UN Water Conference, and UN Summit of the Future. We need everyone's help. Thank you so much, because we all have a stake in this and all a role. And I look forward to working with you in Egypt and with everyone else. Thank you.
Thank you. Thank you, Dame Sally Davis, for your interesting thoughts and valuable input. Now, we'll move with our next speakers, Dr. Shireen Abdelgawad, the head of the Central Administration of Pharmaceutical Care at Egyptian Drug Authority. Please, Dr. Shireen.
Hello, everybody. I'd like to welcome all speakers, the speakers here and the panelists, and the virtual one who joined us online. Well, Dr. Tamer Hassam has highlighted in his presentation regarding the strategy that is adopted by ADA for combating antimicrobial resistance, which is Edasol. So here I'm gonna to just give a brief regarding the efforts that have been conducted by the EDA through this applying of this strategy. Next, please. Okay, the first pillar in the Edasol is the ensure access of safe and effective and affordable antimicrobials. And you know here that we have actually registration process and inspection process and so on, that all are aligned with the international standards here. So we are, and also one of the rule of ADA and mission of ADA is to ensure the accessibility and the affordability of these products. So this is always there. Next, please. For the second pillar, which is develop a specialized regulatory framework, it's the Antimicrobial Rational Use Committee. It includes of different stakeholders from different sectors. UPA, the Unified Procurement Agency in Egypt, the MOHP as the main partner, Minister of Health, the Egypt Healthcare Authority, and other practitioners. Next, please. We have actually different publications and protocols and policies that have been released from this committee. We are proud that we have just 1 year and we have released more than 4 publications so far and policies. One regarding to the prophylaxis, surgical prophylaxis, and the other one is for IV to oral shift and also a monitoring sheet. And still there are some also publications and protocols in the pipeline that will be released by the end of the year, inshallah. Next, please. Then the third pillar, which is adopt and establish laws and regulations. As I mentioned by Dr. Tamer Aissam, we do have this pillar important. We have these OTC lists that have been released and updated that does not include any systemic antimicrobial, and also we have the formulary that is a very good tool for the healthcare providers that can use the Egyptian one. Next, please. It includes all the specification and the data details regarding the antimicrobial that are there in the Egyptian market, classified according to the WHO classification, reserve and the access one and watch list. And it's very, very, very important and give the healthcare providers with this up-to-date data usually. And then next, please. This is the fourth one, which is surveillance, monitoring, and evaluation. It's very important to have this tool. You know, when you are able to survey the situation here in the country, you are able to analyze, to have this gap analysis and able to get the right decision that they should take regarding tackling this problem. So we, as mentioned by Dr. Tamer Aissam, that we have uploaded the AMC on the glass for 2020 and 2021, and it's very important actually to give us a picture regarding the consumption there and let us to take some decisions regarding handling this issue. Next, please. We have this point surveillance survey in pilot hospitals that was conducted in collaboration with WHO and MOHP in 2019 and 2021, and I think it's a very good point. Then they have started, we started by these pilot hospitals, and then they will move on and extend these PPS to a huge number that are there to make it. Next, please. Okay, open to collaborate, as mentioned by Dr. Tamer, it's very, very, very important. And I think, as mentioned by Dr. Hanan and Dam Sally, the importance of One Health strategy, and we have to all to cooperate, not only the human sector, but also with the other sectors, the animal and the plant. We are all working together here in the planet. We have to save our lives. So we are open, and we have started some initiatives and collaboration and cooperations with different stakeholders. Next, please. We have a collaboration with MOHP, and also we have a collaboration with the Egypt Healthcare Authority regarding implementation of antimicrobial stewardship in their hospitals. So we can, as a pilot, and then they will extend and expand this experience and experiment in different sectors there. And then also, next please, we have also cooperate with the Minister of Health regarding the HIV also protocol, guidelines and formulary. And this is just examples for the cooperation, but there are a lot of cooperation, not only in the with internal stakeholders, but also with external stakeholders and organizations. Next please. Level up an awareness education. This is very, very, very important pillar. Actually, I think this is one of the most important in all of you. That we have regulations and we have rules, but without having this awareness for the public and the healthcare providers, the appropriate awareness and education, you're not able to achieve your goal, the optimum goal. So it's very important, and we invest a lot in this one. Regarding for the public, for pharmacy students, and also for healthcare providers. Next, please. One of the main achievements, I think, that it was ADA initiative. It started last year. It's about rational use, and it includes about 39 improvement projects for antimicrobials in different sectors. Actually, this initiative was on 3 stages. The first one is for training. The second, the training for the healthcare providers and pharmacists. We have trained more than 1,200 pharmacists. And then we move to the second level, which is, and second stage is implementation. We have educated the pharmacists there how to analyze the gap there, how to prioritize your problem and to go forward to tackle your problem in your facility. And then the third level is, and the third stage is for implementation. And I think we have a great, I'm very proud about this initiative. We have a great impact actually, and we hopefully to extend and expand the value of this initiative. Please, next. We can see here some of the numbers and figures regarding how average, the increase in the compliance there, the increase of decreasing of the medication error, number of trainees that have been trained by our pharmacists who are enrolled in our initiative, also number of newsletters, committees that have been established, and so on. I'm very proud. Sorry, I talk a lot about this initiative, but I'm very proud about it. And there is also some pharmacoeconomic minimization. Also, there is cost reduction when they apply the projects in their hospitals. Next, please. This is an example for also some publications that we publish on our website regarding antimicrobials targeting healthcare providers that help them to rationalize use and how to form their committee there in their hospitals, the components and so on. I think this is very important, and one of our work there to educate them and to aware them regarding how and the standards for establishing these committees. Next, please. And also, we cannot ignore the public. We have to aware them how this problem is a threat. It's a global threat. We always make these electronic and social media campaigns. We also shared in the WOW Week the previous 2 years, and also we have many activities next week regarding this week. We have lightening the building of ADA. We have make different awareness sessions for students, for public, and for also healthcare providers about the guidelines and the standards for handling antimicrobial. And next, please. Our future plan. This will be our last slide. Please, next. Okay, as I mentioned, we have our initiatives that we will expand and extend the benefits to other stakeholders and other facilities. And also we have these campaigns, social media campaigns, and also not only social media, we also will have this contact physically with other people, with the public. We have also this one regarding the prescription, and we have more control about prescription of the product, and also the vet sector. Vet sector is very important, as we mentioned before, Dr. One Health. We are all working together, we are all in the same planet, and thank you.
Thank you, Dr. Shireen. Really very informative presentation. And now, next, we'll move to our next speaker. We have Dr. Takehiro Nakamura. Dr. Nakamura is the head of the International Environmental Technology Center, United Nations Environment Program. Please, Dr.
Thank you very much for inviting the United Nations Environment Program. I think many of the previous speakers talked about the environmental issues already, and the hygienic environment as well as environmental health, that is also closely linked with the antimicrobial resistance issues. So next slide, please. What we do in relation to the AMR is only under the One Health, the framework, the working together with the Food and Agriculture Organization of the United Nations, World Health Organization, WHO, and the World Organization for Animal Health. Next slide, please. This year, we published this report, Environmental Dimensions of Antimicrobial Resistance. And our key conclusion is environment plays a key role in the development, spread, and transmission of AMR, and is at one of the One Health response to AMR. Next slide, please. The key findings from this report, we are just really identify the key areas of environmental issues related to the AMR in this report. First issue we identify is the manufacturing of the pharmaceutical issues in the production process. The antibiotics, antimicrobials are released into the environment. There's an on-farm application of the AMR in the intensive crop production as well as animal raising. And we also identified several other the issues. For example, sorry, I cannot see very well. Yeah, the waste from healthcare products that from the health sectors, that the antimicrobials are released from the healthcare, particularly healthcare waste may include the AMR, the antibiotics. The poor sanitation and the waste-related issues. We've been working on the wastewater related issues and the waste from the municipal solid waste as well as the household waste, because the people may really try to really throw away the antibiotics into the wastewater and the solid waste systems that will really leak into the environment. And the next one is please, excuse me, can you go back to the previous slide? Oh yeah, that's one. Fecal waste and also animal waste, human and animal waste, that will be containing the antimicrobials, and then that will really also leaking into the environmental situation. Of course, AMR related issues are not only those environmental issues, the other confining the factors are also related to this, including that the population growth, urbanization, and climate change, and several other issues are also the compounding factor for the AMR. Next slide, please. There are several the proposed action in those areas in this report. The poor sanitation, sewage, and the waste effluent in the municipalities, effluent from pharmaceutical industry. Next slide, please. Next slide. Use of the antimicrobials and in the nature, manure in the intensive crop production, and also same in the animal production systems. Next slide, please. Okay, this is overall what would be really be done in terms of really addressing this issue from the more environmental perspectives. Of course, assessment and the monitoring of the antimicrobials in the environment is also important issues. Also really the public awareness raising in terms of household waste. People not really supposed to really throw away the antimicrobials in the waste systems or wastewater systems. And of course, financing is a very, very important issue. And then we also try to really have a more combined the financing mechanism with the public health sectors, environment sectors, and the food system sectors. Next slide, please. And now we are in the climate change COP. And some of us, including the WHO, UNEP, and the FAO, we really prepare the policy brief on the impacts of the climate change on the human health, animal health, food plant, and ecosystems, which is also affecting the AMR issues. For example, change in the natural environment due to the climate change. Due to the climate change, some of the vectors distribution is really changing. Wildlife habitats are also changing because of the climate change. That is also affecting the zoonotic diseases as well as some vector distribution. And increasingly, the severe impact of the climate change is happening, and then frequent and the severe extreme event is really happening. For example, after the disasters, big disasters, the diseases spread very easily, and also this kind of really frequent and the severe natural events due to the climate change will really affect the use of the antimicrobials. And then lastly, and the people are not really taking enough attention to this climate change impact of the AMR, and then further study may be needed, further data should be really needed to really elucidate the relationship between the climate change and the AMR. Next slide, please. And at the same time, I think many of the previous speakers also mentioned there are quite the good global and the regional initiatives that are happening right now. In our United Nations Environment Assembly, we had a resolution on the environment and health. We had a resolution on biodiversity and the health. And in those resolutions, we are calling for action on the AMR. And also African Ministerial Conference on Environment in September this year, they made a specific decision on the environmental solutions to antimicrobial resistance in Africa. So the African ministers of environment are also moving toward addressing this issue. So there's Africa-wide initiatives also happening together with the WHO, FAO, and our colleagues. And finally, our approach is not really addressing only the environment issues. We work together with the WHO, FAO, and the World Organization for Animal Health. We just want to really propose the integrated approach together with other sectors. That's the only solution we can really find in addressing this issue. Next slide, please. Okay, there's a slide about the website location, but I think you can find this report easily on the website. Thank you very much.
Thank you, Dr. Nakamura. It's really an honor to be with us today in our session. Thank you so much. And now we'll move to the second part of our session, which is a panel discussion. Let me inform you that our panel discussion is only 10 minutes long, so please stick to our time. Starting our questions with Dr. Naim Al-Qusayr, the WHO representative in Egypt. First, I'd like to thank you so much. I really appreciate being here today and for your totally and fully support to our team. Thank you, Dr. Naima. My first question will be to you. How WHO, in your opinion, how WHO supporting Egypt in combating antimicrobial resistance?
Good morning, Dr. Tamer, if you are hearing me, and Dr. Hanan, congratulations for making today an AMR, but also One Health. Congratulations to Egypt. As WHO, we have historically been working in this area over a decade. However, we are seeing the culmination. And as Dr. Takahiro ended, now we are doing the integrated approach. We are working together. And we are very pleased to say that WHO in Egypt, WHO region headquarters, we really worked to bring partnerships around. And we meant it. We walked the talk. Dr. Hanan was here last December, and we revived. Already there were sessions. There were already policy advisory groups, technical policy groups. However, now we are having it much more higher level. This is one. The second thing is that today is the Biodiversity Day. And Biodiversity Day is very much linked that we need to protect the nature. And protecting the nature is said by all the presenters. It's the soil, it's the air we breathe, and we have a beautiful lung sculpture behind us. Is at the same time the interaction between the animal, human lives, the ecosystem, and the planet. So we are very pleased that the One Health and AMR is taking a major impact within this COP27 and placing it. As WHO, we are also working with our partners, FAO, UNDP, UN Environment, other UN agencies, but more importantly, and we thank the Egypt Drug Authority with the leadership of Dr. Tamer to bring the private sector and the civil society academicians and researchers. And I was privileged and honored to be last March with you to see the interaction and positioning the heart. Also, you're innovative to reach to everyone, students, regardless of their background, to be part of the initiatives. And we as WHO were proud to be part of this. The interactive, the integrated approach is the key. I said more than decades ago, because we did make a call then to have an integrated surveillance system. I cannot not speak about the role of the practitioners, be it physicians, the nurses, the pharmacists, the veterinarian, the journalist, to bring the voice, to not to use the improper medication. So that's something is now we are very high, but we need to also speak to the practitioners and bring our code of ethics on doing no harm. And no harm means from all angles, including irrational use of medicines, antibiotics, pesticides for the people who are working in the agriculture. The voice of youth has been very big, and we are very pleased that this is the first time we have the highest representation of the World Health Organization in a COP, climate action of conference of parties, and the youth of the voice have become very strong. So we rely on them to bring the messages, and we rely on them not only to push the AMR regional meeting in Oman, but also the 2024 UN General Assembly and beyond. So we look forward to working with you, assure you there has been so many people behind this. Congratulations, Dr. Tamer, for pushing to put this issue at the heart of the COP, at the WHO pavilion, protecting our breathe air, protecting our climate. And this year is the year of our health, our planet for WHO. I want to acknowledge my colleague who is sitting also virtually, Dr. Elizabeth Taylor. She is the focal point or the responsible for the AMR, and bring the message. AMR is one component of One Health, is not all the One Health. However, it's a critical component, because if we do not work on it, we might have, as Lancet February results said, we might have another pandemic. So health security is critical, and AMR is at the heart of the health security. Thank you.
Thank you, Dr. Naima, and so thank you, Dr. Liz, for her effort with us preparing this meeting. And now our second question will be to Professor Hanan Balkhi. Can you hear me?
Yes, I can hear you.
Okay. How can the support that you are providing to countries to address the antimicrobial resistance also strengthen their response to climate change?
Thank you very much. I think it's a two-way street between climate change and antimicrobial resistance. As our colleague from UNEP had mentioned, the climate change impact with floods, tornadoes, displaced populations is going to automatically lead to misuse of antibiotics and decrease in the level of hygiene within the displaced communities and those that are affected by floods, water, and lack of sanitation. So I think that it's really a two-way street. With antimicrobial resistance, the emission of CO2 in the meat production and the need to provide food for the growing global population. Again, as I said, antibiotics are used as a substitute for hygiene. So that is one of the biggest problems. So if we don't understand the complexity of antimicrobial resistance from the environment to the human health sector, to the climate, we will continue to be in this circle of increased resistance from different areas. And that's why we are very keen at WHO to solidify the work with the 4 organizations and with as many partners as possible. And I think also putting in mind that an investment within health and hygiene is also beneficial to the antimicrobial resistance agenda. I hope that addresses. Thank you.
Thank you, Professor Balkhi. Thank you for being with us here today. And now, our question to Dr. Takehiro. What are the key interventions and action to address the environmental aspects of antimicrobial resistance that should be part of all countries' antimicrobial resistance response and professionals?
Thank you very much for this question. As I said earlier, that the environmental dimension is part of this really bigger picture of the AMR issues. So we are not really promoting that all environment should do A or B, but we are promoting that the whole package of the AMR has to be addressed through the public health sectors, environment sectors, animal raising sectors, aquaculture, and all the sectors together to really address this. Otherwise, we cannot really pose any solutions to this issue. That's kind of really the message from the environmental sector. Thank you.
Thank you, Dr. Nakamura. And now back into Ida. The question is Dr. Shireen. Could you provide us more information regarding the antimicrobial awareness initiative that you mentioned in your presentation, please?
Okay. As mentioned and announced by Dr. Tamer Isam, we are proudly and happy for announce that we will start today our new initiative regarding the awareness for the rationalizing of using of antimicrobials. Its slogan is share, apply, and start with us. It's an awareness campaign. We are tackling here 4 levels for the students. For the students in the faculty, youth, doctor, as you mentioned before, this is one of the target pharmacists. This is the tomorrow's pharmacist, and the second one is regarding the healthcare providers in different institutions, and the third group is and stakeholder is for the pharmacists in the community pharmacies. This is the first line that patients usually go and ask them about their health and about the drug and so on here in Egypt. And the last one is with the public. And not only these social media awareness campaigns, but also we'll meet them in different community places like clubs and so on. This will stand for about 6 months, and hopefully we have these achieve a good outcome from this awareness campaign. As we mentioned, this is one of the most important pillars here, awareness. And thank you.
Thank you, Dr. Shri. Finally, at the end of our session, really I'd like to express my sincere appreciation to be with you today, and really thank you to our panelists and speakers for sharing their time, their ideas, and their valuable insights with us that can really give offers to countries and policymakers to make an idea to combating antimicrobial resistance. Thank you to all, and thank you to our attendees today. Thank you.
Thank you. Have a good day. Bye-bye.